Hello, in this video I want to explain a very important trick that is used by the OCD to trick the OCD sufferer that he is responsible for the thoughts or the obsessions, and by doing this, by making him believe that he is really responsible for these thoughts and obsessions, then the OCD maintain itself and make itself stays alive. Okay, so this trick is it depends also a lot on the fear of the OCD sufferer, but also on the guilty feelings. So OCD will always try to make the OCD sufferer feel guilty about these thoughts. And the quick response done by the OCD sufferer is to try to remove or get rid of or eliminate completely the obsession. So one important, very, very important thing in the therapy is that the OCD sufferer gets the strong desire. Of course, every strong desire in our therapy to get rid of the obsession completely is not good for the therapy. The more you desire to get rid completely, you eliminate completely the obsession, the intrusions, then this means that you will fight with these obsessions. You struggle with them. Of course, during this struggle and fight, you will give them a lot of food, a lot of concentration and focus. We have said that in the world of thoughts, it is different than in the world of things, of material things. Material things, if you push a glass, then it will move from point A to point B. In the thought world, if you push a thought, then you will give it food. What is the food of the thought? It is not bread and milk, but it is focus and concentration. So the more you give the thoughts food, you concentrate on them, you try to fight with them, you try to eliminate them. And in fact, the more you try to eliminate them completely, make them zero from the root, the more you give them attention, focus, concentration. So it is very important, extremely important to know this fact, and always to remember this fact that you should never try to eliminate the obsessions. Obsessions are on because of all these years or maybe months. They made their own paths in the neurology in your brain. And they are there working on subconscious or unconscious level, also on conscious level, but mostly they are automatic. They are now automatic. They are now subconscious. So this is very important. The more you try to eliminate them, the more you give them food. If you frankly, if you want the fastest way to make the therapy fail is to try to remove the obsessions from their roots. Eventually, if you stop fighting, if you accept the existence of these obsessions, if you stop fighting, struggling, stop actually the fear, if you accept their existence, then eventually they subside and they will become less and less and less and less and like that. But if you want directly to eliminate them, then you will get the backfire. Okay. you as a teacher, as an engineer, as a doctor, as a employer, as an employee, as a normal person, as an OCD sufferer, your responsibility is to do the therapy, is not to invent new things in your head, especially during the attack, the OCD attack. So your responsibility is not the elimination of the thoughts, of the obsessions. Your responsibility, really your responsibility in front of your God, in front of your father and mother, if you are a father, in front of your son and daughters, if you are in front of your wife, family, your real responsibility is to control your reaction to these thoughts, to these obsession. So your reaction is your responsibility, and not the thought, and not the origin of the thought, not the obsession, not the intrusion. Your responsibility is to control your reaction on them. Your reaction is your responsibility, not the origin, not the thought themselves. We have talked about the white beer experience. The more you want, if I ask you, try as much as you can now, try to forget the white beer. You will keep thinking about it, about the white beer, more and more. Because when you want to get rid of this thought, the white beer, you should concentrate on the concept of the white beer, and this brings the white beer again. So this is it is very important to know that your responsibility is not to get rid of the obsession. I know these obsessions are very painful. You feel guilty about them. You feel not a good mother, or not a good religious person, because you get all of these obsessions and OCD signals, false signals. You feel a lot of fear, a lot of pain, a lot of guilt. But still, your responsibility is not the thoughts, is not the suppression, is not the get the thoughts eliminated. No, this is not your responsibility. Your responsibility in the therapy is to, and also in front of God and in front of your family or the law or everybody, is to, your responsibility is your reaction to these thoughts, to these obsessions. This is the therapy. If you want the therapy to fail, then you should try to look to your thoughts, your false signals, your false obsessions. Even if they feel real, you feel them as a really, really, really true, really, really as a fact, really painful, really. No, this is not your responsibility. Your responsibility is to see how can you react to these thoughts. What is the good way to react to these thoughts? Of course, you learn the reaction in the therapy, and not, I repeat, not to discover and to invent new strategies during the OCD attack. Maybe you can later contemplate, reflect on your reaction. But during the OCD attack, you are only allowed to follow the therapy, because during the OCD attack you are inside the bubble, inside the OCD personality. I will talk more, of course, I will talk more about acceptance as a core process in ACT, in acceptance and commitment therapy, but it's also very important in the therapy. And also I will talk about how can you do that, how to control your reaction, what to do. So it is very important. So is that your responsibility is the reaction, is your reaction. I will keep repeating that, because it is very important. This fact is very important. Okay. Your brain is looking to you, is looking to your reaction. Reaction is a behavior. Your reaction is a behavior. Even if your reaction was an internal behavior, like you struggle with the thought, You try to challenge the thought, negate the thought, okay? Fight the thought. This internal compulsion, internal ritual, is still a behavior. Your reaction to the thought is a behavior. Your reaction to the thought is a behavior, okay? The appearance of the thought, the appearance of the obsession is not a behavior. It is something different. So you are responsible for your behavior. You are responsible only for your reaction. There you should work. There you should do the therapy. Okay, now the language of the brain. Your brain understands very clearly this language, the language of behavior. Your reaction is your behavior. The brain will look to your behavior, your reaction. The brain will look to your reaction. If in any time a thought appears simultaneously, or maybe before it appears, you expect and you fear and you are scared, you get fear, then that tells the brain, okay, each time you see such a thought, activate fight and flight response and narrow your attention and focus only how can you escape or fight. That means focus, so your pupil will get smaller to focus only, to permit less light, and also so that you can focus only, you will focus only on your danger. That means you focus, that means you give more and more food to this monster, okay? Okay, so every time you get panicked, you get scared, when you see the thought or the obsession, and every time you try to get rid completely of the obsessions, so you try to eliminate completely the obsessions, to make them zero, then you increase your fear every time a small obsession or a small thoughts, negative thoughts, small intrusion comes to you. Your brain is watching you. If you get panicked and you react to these obsessions in a bad way, then your brain will learn this process. The brain will learn how to react. And the more you repeat this action, or in fact reaction, the more you repeat this reaction to the obsessions, the more you teach your brain how to react to these obsessions. If you want to get rid completely of these obsessions, you want to remove them and eliminate them completely, then you become fearful, you get scared, you get panicked from the obsession itself. So you will get a cyclic negative feedback about this obsession. You will be obsessed about the obsession, because now you don't tolerate even 1, 2, 3% of the obsession. You want to eliminate them completely. So every small appearance of the obsession will make you panic, will make you scared. Okay, that means because you don't tolerate even this small percentage of the obsession, then you will get obsession about this obsession. You will get fear about this obsession. You will be obsessed about the obsession. And your brain is watching you. Every time you are afraid, you are panicked, he will activate the fight and flight response. That means, repeat this reaction every time you see this obsession. And you teach your brain the fear way, the fear path. This way to react to the obsession, which will reinforce your reaction to the obsession, because each time you react, there is a neurological path is built to make this action or reaction, in fact reaction, to make this reaction easy. This is why after some months, after years, this reaction, your reaction to the obsession, will be automatic. Sometimes even you don't feel it. This is why sometimes we advise you to. This is why we use mindfulness to lessen this automatic response, to introduce the consciousness in this process, to try to make the process less automatic. Okay, so your brain is watching you. The brain is watching your reaction. The more you react with fear, the more it activates the flight and fight response, and then that means that your reaction was important, and really the obsession was very important. The obsession was very dangerous. This is why you was fearful. So this is why you have reacted very compulsively, very fearfully, very in a panic way. Okay, that means that these obsessions were really important. But this is not the thing that we try to teach your brain. You should teach your brain that these obsessions are nonsense, nothing. They are against my values. They are against my personality. They are nothing, in fact, because I'm not responsible for them. They came to me. I am not thinking them. They are in my thought. They come to me. I don't want them. There is a difference between you want to kill someone, you want to plan, and you enjoy planning to kill someone, and thoughts comes to you about planning about killing someone. In the first case, when you enjoy these killings and planning to kill someone, and you plan and you spend energy and time to do that, and you are enjoying the process. But in the second case, when these thoughts comes to you about planning or killing someone, you don't enjoy them. No, even you are panicked and you get OCD problem. So there is a big difference. Okay, so your brain is watching your reaction to these obsessions. The more you are panicked, the more your brain will learn that these obsessions are really important. You should activate fight and flight response. You should focus. You should react. You should that and that and that and that. And thereby you make the obsession stronger. In fact, what you should do is the therapy. And of course, I will explain more about that. What are the steps of the therapy? The steps are relabeling, reframing, refocusing. Okay. Sometimes relabeling and immediately refocusing. With some sufferers, OCD sufferers, step 2 is not helpful. Sorry. So they should move from 1 to 2 or from 1 to 3 and not 1, 2, 3. Okay. But I will explain that later in detail. But now I simply make introduction and try to convince you about what you should do and try to explain more and more, so to shed light about that, because you are walking in a dark jungle. Okay, and take care and see you in the next video.